Hello everyone, my name is Ankit Kumar Mukhopadhyay. I'm a second year student at RG Medical College and Hospital, Kolkata, and today my topic of discussion is the Virchows Triad of thrombosis. So what is the Virchows Triad, you may ask? It has been defined by the Robbins Book of Pathology as the primary abnormalities that lead to the thrombosis, which are explained by a group of three factors, a triad that is known as the Virchows Triad. So what are the Virchows Triad? It has been shown in the diagram as number 1, endothelial damage, number 2, abnormal vascular flow, and number 3, hypercoagulability of the blood. So what are the factors that are causing the endothelial damage? Number 1 is the trauma, which is the most common cause because it will cause a direct endothelial injury. Inflammation, the neutrophils while rolling and adhering on the surface of the endothelium will cause direct endothelial damage. And lastly, hypercholesterolemia or the atherosclerosis. In this case, the oxidized LDL that is present in the macrophages will cause, also known as the foam cells, will directly cause the damage to the endothelium of the blood vessel, causing the endothelial damage. Second in this triad is the alteration in the blood flow. Now normally the blood flow is an axial laminar flow. What is this axial laminar flow, you may ask? It is a blood flow in which the RBC, WBC and platelet will flow along the central axis of the blood vessel and the plasma flows to the periphery. Now whenever there is a disruption or alteration of the laminar blood flow, the platelet that is present in the central axis of the blood vessel will migrate to the periphery. This will result in the endothelial damage that will trigger the formation of a clot. Secondly, the stasis of the blood can also play a vital role in the alteration of the blood flow. Directly by the disruption of the laminar flow, it can mediate the action, and secondly it can also promote the endothelial activation, which enhances the procoagulant activity, resulting in the thrombosis formation. And the last factor of the triad is the hypercoagulability. Hypercoagulability can be of the genetic cause or the acquired causes. Genetic causes: factor 5 lead-in mutation. Now what is this factor 5, you may ask? The factor 5 that is present in the clot is normally degraded by the protein C that is present in the blood, but in the factor 5 lead-in mutation, the factor 5 resists the cleavage by the protein C. It will persist in the clot. It will result in the formation of a thrombus and result in the hypercoagulability of the blood. Prothrombin gene mutation increase prothrombin levels in the serum, which will increase the risk of thrombosis by 3 times. Protein C and proteinase deficiency and antithrombin 3 deficiency, all of these belong to the category of the body's anticoagulant, the deficiency of which will lead to the hypercoagulability of the blood. Homocystinemia will directly cause the overactivation of the fibrinogen and it will result in the hypercoagulable state of the body. Now what are the acquired causes of hypercoagulability, you may ask? The prolonged rest and immobilization, which will ultimately cause the stasis of the blood, that will result in the alteration of the laminar blood flow, resulting in the thrombosis. OCP can also cause the hypercoagulability. Nephrotic syndrome: in the nephrotic syndrome, the protein that is the antithrombin 3, which is the body's anticoagulant, will be lost in the urine. The anticoagulant deficiency will result in a hypercoagulable state of the body. Other acquired causes are the DIC and hyperestrogenism. So this was all about the Virchows Triad of thrombosis. Thank you.